hope each and everyone is doing well and good. And it is me, Dr. Amrita here. And so many of them message me to put a video for anatomy. I don't want to waste your time. I will say everything quickly. It's the most important question for your Neet PG. And I want to say that this video is exclusively for people who are going to start anatomy for the first time. And it is all time dedicated for the latecomers. And if you guys wish to get anatomy 80 to 90% of mark just to watch this video. Say I'm going to say the crick and the knack method to get around 80 to 90% way. So how am I saying? Yes, when you analyze the previous year's Neet PG as well as FMG from 2019 onwards, you can see that the anatomy, the number of questions being reduced, less than 10 questions we are just seeing. So always understand the anatomy is getting integrated with surgery as well as orthopedics. So if you are going to plan to start anatomy, and I will say that yes, of course you can finish anatomy so soon, and always understand that there are less number of questions being asked in anatomy, so it is not needed to spend as much of time in and out behind this anatomy. See, this Neet PG is a wise game track. So you want to use your brain wisely. Don't spend unnecessary time for unimportant questions. Okay. So because here there is no Viva, so nobody is going to judge you. So what is your key point? You want to knack and crack that MCQs. So how to get this anatomy? I will just say fast and finish it off. Always understand there is a question from upper limb, lower limb, histo, embryo. Lower limb, very, very important. So when you learn this lower limb, study the surgery part, that varicose things, how that classification, as well as here the nerves and the veins, very, very important every time. And also how you elicit the popliteal, that is also very, very important. So the nerves and the veins, very important. Just study it. Then upper limb, very important because they will integrate with orthopedics and all those nerves. So which nerve you get in, like wrist drop? Yes, of course, you will be knowing radial nerve. So what about this median nerve, ulnar nerve? Just integrate with orthopedics. Study histology because there is a sure shot. So when you again analyze from 2019, you can see that every time there is a question in histology. So they will put the picture and you want to identify. So once they have asked thymus, they have asked pancreas, they have asked thyroid. So histo you must learn. So histo, embryo. Embryo you will be knowing from third arch, what is there, fourth arch, that's all those things, what is coming and all those things, facial nerve, which brachial arch and all those things. And these are the sure shot question because one question will definitely be there. And also I'm going to say certain important topics that is being repeatedly asked. I'm referring it from the official Neet PG syllabus. So let me say that just you want to learn that 100%, never ever skip. That is from the 2019 analysis. Very important question that I'm going to say. The diaphragmatic opening and the embryology. I told that histo, embryo, upper limb, lower limb, definitely there will be a question. So that diaphragmatic opening, very, very important. That is which are like T8, like what is the other structure, like right phrenic, there is a mnemonics like I8, 10, X at 12 that you will be knowing. So very, very important. T8, T10, you will be like 10 is esophagus, you will be knowing that T to iota. So what accompanies, you will be knowing that iota means what? Ascygos, thoracic duct and all those things learn because repeatedly they will be asking that central tendon develops from where, that is septum transversum. Pleuroperitoneal membrane contributes and all those things, while are very, very important. And about, yes, again they link with surgery, that is that Butcher's hernia, and that's most common congenital CDH, congenital diaphragmatic hernia. So what is the most common side they'll be asking? That is very important. While I just read it, whether it is Butcher's hernia is in the right or the left, all time favorite question they will be asking, that you can read it. And also very important, so this sometimes you will learn this diaphragmatic opening, but you don't know where it is. That picture wise, it is in the textbook, just study it. Voila, the tongue thing, that is anterior 2/3, posterior 1/3, posterior most. What about that nerve supply? Very important. As well as 2020 and 21, you can see a question like that lingual nerve as well as hypoglossal nerve. Very important. Lingual nerve is very important. So many questions from that lingual nerve. Voila, please learn it. And so 12th nerve palsy occurs in the brainstem syndrome. What is that? Medullary syndrome. Please read it. Very important. And also one important question is tongue deviates to the same side. So what is happening? So which nerve is affected? The same side. Very important. Please do. And also what is a nerve supply for uvula, and also please learn it. And also very important, muscles of mastication. Very important. Every time they used to repeatedly ask about that lateral pterygoid. So you want to study to identify the muscle as well as the action. There are certain muscle for depression. There are certain muscle for the elevation of the jaw. Please learn it in and out. Okay.